Stomach pains in children causes, prevention, and home remedies. Stomach pain is a common problem in children below 15 years. In most cases, stomach pain in children is never a serious issue because it can go away in hours. Children, especially toddlers, are more likely to develop stomach pain because they are never careful with what they eat and touch. There are many causes of stomach pains in children, and as a parent, you should beware of these causes to keep your child safe at home. Keep watching to learn more about the causes, prevention, and treatment options of stomach pains in children. What causes stomach pains in children? Number 1. Bacterial infections. Children below the age of 11 are more likely to develop stomach pains because they are never careful with what they touch and eat. Viral infection in children can cause stomach flu and chronic abdominal pain. Children with viral infection exhibit symptoms such as diarrhea, nausea, cramps, and fever. Number 2. Food poisoning. Your child can develop mild stomach pains because of food poisoning. Naturally, your body develops resistance to any foreign materials that enter your stomach. Additionally, eating a lot of food can also cause bloating, heartburn, and temporary discomfort in children. Number 3. Drug overdose. Children like to explore and get into trouble in the process. For instance, if you have a toddler at home, they will likely touch anything and try to ingest it. That's why you should not leave your child unattended. Keep your drugs, polythene, chemical, soap, and other dangerous house supplies out of your child's reach to prevent poisoning. Poisoning can also result from a drug overdose, for example, giving your child excess acetaminophen and iron pills. Other causes of stomach pains in children include inflammations in the gut or irritable bowel, indigestion of food in the stomach, stress and anxiety, infections like gastroenteritis, period pains. Some girls can have a lot of pain before periods. Appendicitis, which cause sharp stomach pains in children. Symptoms of stomach pains in children. Stomach pains in children show in a different way depending on the cause of the problem. Here are some symptoms of stomach pains in children you should beware. Vomiting, nausea, difficulty passing gas, loss of appetite for food, fever, constipation, diarrhea. When should you call your doctor? Stomach pains in children normally disappear in hours. However, in some cases, the problem may persist, causing too much pain to the child. Therefore, if you feel like the pain is getting off hand, you should never hesitate to contact your doctor. You should take your child to the doctor for medication when Number 1. You notice blood spots in the vomit. Vomiting blood and blood in stool are some red flags for chronic stomach pains in children. When the child vomits blood, it is a red flag that you should contact your family doctor for immediate medication. Number 2. Blood in stool. Blood in stool is a common symptom of constipation in both children and adults. However, when your child has chronic stomach pains and blood in the stool, it should be a reason to contact your doctor. Number 3. Severe pain. Stomach pain or pain in the lower abdomen can be severe at times. The measure of discomfort will depend on whether your child can bear it or not. If the child cries a lot or is experiencing discomfort sleeping, you should not hesitate to visit your doctor. Number 4. Pain in the lower side of the belly. Sometimes the appendix can move to the right lower quadrant and cause your child a lot of pain. Any pain in the lower belly should be checked out immediately, especially in girls having their first period. Number 5. Loss of weight. Your child becomes weak and dehydrated when they lose water through diarrhea. If your child is having recurring stomach pains and losing weight, you should have a trip to the hospital and have him checked out in time. Number 6. High fever and persistent cough. Bad cough and severe fever are some symptoms of pneumonia. Some viruses can also cause severe stomach pain that comes along with fever and cough. If your child has prolonged stomach pain, breathing quickly, and cough, you should not hesitate to visit the doctor. Number 7. Burning in the upper abdomen after meals. Your child will always develop heartburn when they eat cold food or eat a lot of food in a sitting. Don't give your child carbonated drinks that will increase gas production in the stomach. Give your child small meals because overeating food can result in bloating and stomach upset. What you should do when your child has stomach pains. Let's explore these tips. Number 1. Take rest. When your child has acute stomach pain brought by constipation or allergy, you can ask them to take some rest to relieve the pain. Ask the child to sleep facing down to ease the gas pain. Number 2. Drink plenty of water. When your child develops stomach pain symptoms like vomiting and diarrhea, they lose a lot of weight and become weak. Number 3. Medication. There are many OTC painkillers you can give your child when they develop stomach pains. You should avoid using antibiotics to treat chronic stomach pain in your child unless you have a doctor's prescription. Number 4. Help the child recover. Encourage the child to sit in the toilet and poo. Going for a long call in the toilet can sometimes help to minimize mild stomach pains in children. Number 5. Distracted the child. You can also help your child minimize stomach pains by telling them to read a book or keep them watching a favorite show on TV. Distracting the mind from the stomach pain is one way of coming with a mild stomach ache. Number 6. Change of diet. Give your child their favorite meals when they are hungry. Stomach pain can always result in a loss of appetite for food. Ensure your meals have a lot of fluids to keep your child hydrated. You can give your child toast, rice, crackers, and banana. Number 7. A warm bath. Give your child a warm bath or place a bottle of hot water on the child's tummy to improve blood flow in the body and reduce stomach pain. Number 8. Avoid spiced meals. Once the stomach pain symptoms go away, you should avoid giving your child spiced and caffeinated drinks for the next 2 days. You want to keep track of what your child eats, especially when they are under antibiotics to relieve stomach pain.